serotonin. And there's all of these people, tons of them, who can't take any of those SSRIs because of the way their brain works with serotonin, and with that stuff, it just doesn't work at all. And I'm wondering, I don't know, I'm just wondering about psychedelics in that or something. It seems like there's like this sort of one serotonin, do you know what I'm saying? I don't know, I'm just wondering.
Yeah, so SSRIs are standard antidepressants. The mechanism is thought to be, it's not like you block the serotonin reuptake pump and you get better. It's more like you block the serotonin reuptake pump, wait 4 to 6 weeks, and then you get better. Within that 4 to 6 weeks of getting better, though, a lot of different things can kind of happen. Some people get more energy, which they experience as anxiety. Some people, especially younger people, about 1 in 50, get increased thoughts of hurting themselves in this period of time. There's also kind of just mild serotonin toxicity types of side effects like stomach upset, diarrhea. It could be drowsiness or insomnia. So for a lot of people, that first 4 weeks before it takes effect, if it takes effect, it's about a coin flip whether it will work after 4 to 6 weeks. They have a rough time making it to the place of it working. So with the standard antidepressants, the thought is it's more of a long-term neuroadaptation event in response to blocking the serotonin reuptake pump that makes them better. Whereas with psychedelics, it's much more cathartic and immediate. And certainly, not everyone has a blissful and mystical and unitive type of experience taking psychedelics, especially the first time. But it does seem that with a supportive container, there's still an opportunity to learn something about themselves, the way they think, the way they feel, and some positive event or effect coming out of that.
But is it the serotonin? What's the serotonin play that's happening within the psychedelic experience? You don't know. You're not saying it.
The play.
Like in the SSRIs, you're saying 4 weeks before.
Yeah.
You're not saying that with a psychedelic experience, the serotonin thing is happening now.
Oh no, it's serotonergic immediately.
Oh.
I think she's asking if an antidepressant doesn't work because of some serotonin issue, would psychedelics not work also for the same person?
I am sort of implying that also, but I'm fascinated to hear
Are there
that
people that are psychedelic resistant, essentially?
Right.
Or, I think it's a very interesting question, and I don't think they've really run into that issue in the research they've done to date, but it's also kind of in a preliminary phase. So.
Well, it is just fascinating to me that the serotonin works straight away.
Yeah.
That's something really big right there.
Right.
Yeah.
And even if they were just had the same level of efficacy as the standard antidepressants, the fact that they work almost immediately is an incredible advantage.
Yeah. Wow. Okay, thanks.
Yes, sir, with the scar.
Can you please touch upon dopamine a little bit, especially with relation to LSD and how it interacts with dopamine, and what if that's a risk factor for clients who have ADHD?
Yeah. Okay. So I'm not sure if it's a risk factor for clients that have ADHD, but compared to other tryptamine psychedelics are correct in that most of them just bind to the serotonin 2A receptor. LSD also binds to dopamine receptors, and specifically dopamine 2 receptors. And when you're kind of thinking about drugs to treat psychosis, the drugs that treat psychosis block dopamine 2 receptors and serotonin 2A receptors. So essentially, LSD is an antipsychotic in that it's almost, you could, I hate to use this phrase in this talk, but you could consider LSD pharmacologically to be a pro-psychotic in that it stimulates dopamine and serotonin 2A receptors. Doesn't really seem like there's more of a signal with LSD used to cause, long-term harms compared to other psychedelics. But at the same time, I think that that's like a really interesting and kind of novel piece of LSD's pharmacology that, you know, probably does deserve further study.
Thank you.
With ayahuasca, you mentioned benefits of the vine with Achapurna.
Yeah.
What are those benefits? And also, what are the potential risks with MDMAs, aside from just SSRIs and things like that? What else can be a problem?
Yeah, so as far as benefits, I mean, probably wide-ranging. I think traditionally ayahuasca has been used as kind of an anti-parasitic type of agent, or even an antibacterial agent, like things like gastrointestinal dysentery or parasites, because it's so physically kind of cleansing and kind of getting everything out of the GI system. A lot of people would just report that, hey, if you drink a vine-only brew once a week, or even take a microdose of vine every day, then it does have a very mood uplifting type of effect. If you're ingesting ayahuasca every day, now you're going to have to kind of be on a special diet probably, as well as watching out for these drugs. Really, with the most serious risks of drug interactions have to do with drugs that block serotonin reuptake, which are the traditional antidepressants, or drugs that release serotonin, which are things like phenylethylamines or MDMA. There's certainly a host of other drugs out there that kind of have questionable activity at the serotonin reuptake, and things like methadone, tramadol, you know, these have kind of like weak activities there. Things like amphetamine just boost your blood pressure in general, but they are also very weak serotonin reuptake inhibitors. So as far as absolute contraindications, drugs that block serotonin reuptake and drugs that release serotonin. As far as relative contraindications, or potentially only with expert oversight, there's some kind of other more gray area drugs. There's really serotonin blockade and serotonin release that are the two that are absolutely bad.
What other food contraindications?
The food contraindications have to do with tyramine, which is an amino acid found in fermented foods. So this is oftentimes called the cheese reaction, because it was first observed with fermented cheeses or aged cheeses. So things that are aged, smoked, pickled, these probably are things that have high amounts of tyramine in them. Compared to the drugs, though, the dietary interactions with ayahuasca are probably a little bit lesser of concern, because the tyramine's eliminated from your body extremely quickly. So as long as you're not having like a blue cheeseburger in your ayahuasca experience, you're probably going to be okay. You know, you could actually ingest tyramine up to just a few hours before drinking the brew, and then you could reintroduce tyramine essentially 24 hours after drinking the brew, and you're not going to be really a risk for any type of hypertensive crisis or cheese reaction. Yeah, we'll have more time.
More questions afterwards. Awesome. Thanks, Ben. That was excellent.
The last dose of usually.
So I feel like this quote perfectly depicts the concept that is paramount in psychedelic work, that it is in fact work. We don't do psychedelics to